Hello, everyone. Today we are looking at medical futility, application and implication in healthcare practices. My name is Dr. Dixon Ofojabe. To continue this discussion, I would like to run us through the table of contents, what we have in this presentation. We are going to define medical futility, the types of medical futility, determination of medical futility, why is medical futility controversial, what is the difference between futility and rationing, medical futility from ethical theories perspective, and then we shall summarize our discussion and provide some reference for further consultation. What is medical futility? I am sure this term is not new to those who are maybe medical students or in the medical practice, but for the purpose of clarity and to give our discussion a proper perspective, I would like to run through what the definition of medical futility is. Futility is that term used to refer to the lack of benefits of a phenomenon. Applied to medical arena, futility refers to treatments that are determined to produce no beneficial outcome, or it applies to medically ineffective or even harmful to the patient according to the standards of care. A treatment may have effect on patients, but may not benefit them. It is like treating the disease and not the patient. There are no universal rule for futility applicable to all medical situations. Rather, in accordance to best practice, futility is restricted to a particular intervention at a particular time for a specific patient. Types of medical futility. There are two major types of medical futility: the quantitative and the qualitative. The quantitative is where the likelihood of an intervention will benefit the patient is exceedingly poor. For instance, having used a particular treatment multiple times with no improvement or benefit, it would be futile to attempt this treatment again. Whereas in the case of qualitative futility, we are talking about where the quality of benefit an intervention will produce is exceedingly poor. For instance, it will be futile attempting to resuscitate a patient that is in permanent vegetative state. How do we determine medical futility? We shall cover the who and how question of determining medical futility here. Medical futility is essentially a non-arbitrary professional decision in collaboration sometimes with the court of law as well as the patients. There are disagreements between physicians and patients when it comes to determining medical futility. Patients' autonomy tend to be at conflict with beneficence, non-beneficence, and even sometimes distributive justice. According to best practices, shared decision in making this important, asserting this important step of futility is often encouraged. The physician who unveils a family's value, clarifies medical standard of care, explicates effectiveness from beneficence versus harm, and respectfully explains the alternative care plans is more likely to find a common ground when it comes to discussing with patients in medical futility. Why is medical futility controversial? I'm sure that is a very legitimate question that often comes up whenever we encounter a discussion like this, that concerns medical futility. Why is it controversial? The significance of medical futility in clinical practice is probably the reason it is highly contested. Apart from the lack of unanimous standard for defining medical futility, it has also understood as giving unilateral decision-making authority to patients at the bedside. In other words, some people feel that medical futility is all about the physician wielding his power, his power of knowledge, his professional judgment against the physician, against the patient. In clinical setting, an appeal to futility can sometimes function as a conversation stopper. In other words, people believe that whenever a physician begins to talk about medical futility, he is close to further discussion. He is not willing to hear from the patient whatever suggestions they have, and that is actually not correct. Thus, some clinicians find that even when the concept applies, the language of futility is best avoided or replaced with inappropriate in discussions with patients and family. This is just an effort of semantics to use the right language in presenting the situation. The term medical futility can create a false impression that medical decisions are value neutral and based solely on the physician's scientific expertise. Yet, clearly, this is not the case. The physician's goal of helping the sick person itself a value stance, and all medical decision making incorporates that value. Is medical futility different from rationing? There is a link between medical futility and rationing. Some people would prefer to assert that medical futility is a tool for rationing in healthcare. However, futility refers to the benefit of a particular intervention for a particular patient, while rationing is focused on how to best utilize scarce resources. Both medical futility and rationing ask different questions. While futility is concerned with, does the intervention have any reasonable prospect of helping this patient? Rationing entertains questions like, how much money or resources does this treatment cost, or who else might benefit from it? Having drawn the line of demarcation between medical futility and rationing, we would like to look at medical futility from ethical theory perspective. There are several ethical theories that could shape the medical futility discourse. However, for the purpose of this presentation, we shall take a look at two ethical theories, the duty ethics, the duty-based ethics, and the virtue ethics, in terms of what demand they place on care providers in the event of medical futility. According to duty-based ethics, a physician is not obligated to provide a medically futile intervention to patients. It is important for physicians to respect their patients' autonomy and allow them to choose from medically accepted treatment options. However, this does not mean that the patients are entitled to receive any treatment that they ask for if it is believed that there is no clinical benefits. Futile intervention may increase a patient's pain and discomfort, give patients and family members false hope, delay palliative and comfort care, and expound infinitely medical resources. Medical futility, from another perspective, from the perspective of virtue ethics, entails that according to the tenets of virtue ethics, sometimes called character-based ethics, A care provider should cultivate the habit of compassion, concern, caring, sympathy and empathy, modesty, patience and courage. All these virtues and many others have no norms of obligation. In other words, the virtue ethics encourages care providers to develop the habits of some good values that would help them as a result of those habits that they have cultivated over time to care for patients in the event of medical futility. These values, like courage, would assist a care provider to have the difficult discussion that is usually associated with medical futility, discussing with the patient and the family members transparently and openly according to the medical indication presented in their case. So there are so many other values for medical ethics that could help in the conversation when it comes to medical futility. Having said all these, we'll look at the summary points of this discussion. In this presentation, we have attempted to discuss medical futility as well as demonstrated the different types of medical futility. We said in this presentation that there are two types of medical futility, the qualitative and the quantitative, and we tried to show the difference between them. We went on to talk about the determination of medical futility. Having said that the determination of medical futility is controversial, we went on to talk about how and why determination of medical futility is very important for various reasons mentioned above. We went on to show the relationship between medical futility and rationing, because sometimes they are often confused. Some people might think that medical futility is rationing and rationing is medical futility, but that is not exactly the case. Although in discussing medical futility, one would have at the back of his mind rationing, but the purpose of medical futility, the goal of medical futility is not so much about the managing of resources. It is more about giving the right kind of care that is medically acceptable, both from an ethical and legal perspective. So we also went on to talk about two ethical theories that helps us to understand medical futility. We mentioned the duty-based ethics of Immanuel Kant, and we also mentioned the virtue ethics. And these two ethical theories really helps us to deepen our understanding of medical futility. And that is the end of this presentation on medical futility in application and implication in healthcare practice. I have here some references, and it will be important for us to go through them so as to gain more insight on this topic. Thank you for your time.